New data has presented yet another damning assessment of Queensland's health system. A lack of beds and staff is leaving more than half of all critically ill patients waiting in an ambulance for longer than recommended outside many of the state's major hospitals.
Queensland's health system is in distress and the symptoms are worsening.
It is concerning, it is a crisis.
New figures show at least half of ambulance patients at 11 of 26 hospitals were forced to wait at least half an hour outside the emergency department in July. Topping the list was Redland Hospital, where 3/4 of people were left outside for more than 30 minutes.
And if ever you need proof of the government losing control of the Queensland health crisis, this is it.
At the time, COVID-19 held a tight grip on the health system, with thousands of staff furloughed and hundreds of patients in hospital with the virus. Despite this, Queensland's peak medical body says the issue is nothing new.
This is something that was brewing even before COVID, and obviously this is where we're seeing that crisis. We are seeing people waiting outside ambulances trying to get in.
The AMAQ has bailed the cat. This is not the fault of COVID. It is 7 years of decline.
When Anastasia Palaszczuk took on the state's top job in 2015, ambulance ramping sat at just 15%. Today, she remained tight-lipped on the issue.
Oh, look, the Health Minister will address you later on following Cabinet today, as you can appreciate. But let me say this. Today we are seeing in our hospitals, as a result of COVID, less than 100 people. These are some of the best figures that we are seeing.
The Queensland AMA is calling for more staff to be deployed to the state's hospitals to ease pressure, but the opposition has gone a step further.
The Health Minister should be sacked. Yvette Das should be sacked by the Premier today.
It's a demand the Health Minister has since refused. Lucy Gray, Sky News.